So in this short discussion, we are going to talk about the osteoporosis, osteoarthritis, and rheumatoid arthritis. So osteoporosis, basically the rate of bone resorption is more than the rate of bone formation. If the bony tissue or bone mass erosion is more and bone formation is less, patient develop osteoporosis. Different way I want to tell you, if the osteoclastic activity is more but osteoblastic cell activity is less and bone mass is lost, patient develop osteoporosis. So deterioration of bone tissue, low bone mass, and lead to the fracture of vertebra, pelvis, or femur. So if the rate of bone eruption is more, osteoclastic activity is more, and rate of bone formation is less, or osteoblastic activity is less, resulting in the low bony tissue density or low bone density and also fragile bones. And osteopenia is a precursor of osteoporosis. So what are the risk factors patient chance to develop osteoporosis? First of all, hereditary or decrease the physical activities, smoke or alcohol, low body weight, low calcium diet, and prolonged premenopausal stage or amenorrhea. Basically, the female gender are more risks to develop osteoporosis in relation to men. Or any thin or lean body, we say low body weight. Or if menopausal states or prolonged premenopausal states. If patient have a amenorrhea for a long time, they chance to develop osteoporosis more. Or insufficient calcium intake or vitamin D deficiency, smoking, alcohol abuse, or excess caffeine, all can cause osteoporosis. Even lack of physical activities or hyperparathyroidism or long-term steroid use or long-term anticonvulsant medication can cause osteoporosis. What are the findings or sign and symptom of osteoporosis? Patient develop back pain, increase with activities and decrease with rest. It is the nature of pain because due to osteoporosis. Pathological fracture and decrease the bone mass. So fracture is most common who have osteoporosis. If they fall, bones are broken. Fracture occur in vertebra, pelvis, or femur. Sometimes deformity of vertebra, we call kyphosis, also reduce the height because of erosion of the bones. And back pain is the most common and early sign. How we diagnose this? So bone density study, or we do the dual X-ray. What are the intervention or education to the patient, and also the treatment? Basically, the calcitonin or estrogen increase the risks, help to the patient to bone erosion. But here is important, if you give the estrogen replacement therapy, increase the risks of breast cancer and deep vein thrombosis in case of estrogen replacement therapy. Most popular drugs we use is called calcitonin, or other medication we can use like Bonviva is called ibendronate, or we can use eldendronate, Fosamax, or we can use the raloxifene. NCLEX board asks a common question about albendronate. So after give this medication, remain upright for 30 minutes. Let me recap it. Like your patient has an osteoporosis, doctor prescribed albendronate or Fosamax or Bonviva, ibendronate. As a RN or as a LPN, when we give them this medication, educate your patient, remain upright for 30 minutes after taking this medication. Super important for NCLEX board. So what next? So after giving this medication, especially raloxifene, we have to check the blood pressure, body weight, and monitor the liver function test. The side effect of raloxifene, water and salt retention. So monitor the body weight and blood pressure frequently. What are the other education need to tell your patient? So you see what wrote, encouraging the weight bearing exercise. So tell your patient to get sufficient calcium and vitamin D. Also moderate sun exposure. Also weight bearing exercise and home safety measure to prevent the fall. If they fall, they can causes the brokens of the bones. So now we are going to talk about the rheumatoid arthritis. It is compare and contrast with osteoarthritis. First one is the rheumatoid arthritis. Rheumatoid arthritis is a systemic and chronic inflammatory disease of the joint. So two words. One is the chronic and systemic inflammatory disease that affect all joint in the body. The cause is unknown. Inflammation, small joint or hands, wrist, or feet. Morning stiffness. When patient get up from the sleep, their joint is rigid, stiffness, difficult to move. But when increase the day or pain reduce with activities. So what are the key points here about the rheumatoid arthritis? This is the inflammation of the joint, and pain occur at the morning or morning stiffness, but pain get better with movement. Usually all joint effect in the body, and joint is bilaterally attacked. Bilateral means both side joint getting attacked. The other sign symptom of rheumatoid arthritis are fatigue, weight loss, and low-grade fever. And sometimes NCLEX would ask, will this joint be affected unilateral or bilateral? In case of rheumatoid arthritis, bilateral means both hand, feet, or knee get involved. So should we encouraging that client to exercise? Answer is yes, because activity helps to reduce the pain in case of rheumatoid arthritis. So what about the treatment option? We give aspirin or NSAID, non-steroidal anti-inflammatory medication. So NSAID are the primary drug therapy. Other medication we use steroid or immunocompromised agent like adalimumab or hydroxychloroquine. What about the osteoarthritis? Osteoarthritis is a progressive degenerative disease of the joint or articular cartilage in the joint. The risk factor of osteoarthritis usually obesity, genetic predisposition, or older age, obesity, smoking, or repetitive stress of joint. So other signs and symptoms are